Uh, okay, good. So, thank you everyone who joined in. I just want to welcome Gurleen Kaur. She's a third year internal medicine resident at Brigham and Women's Hospital, Harvard Medical School in Boston. So we are all very proud of what she has accomplished already in her young career. She was born in Delhi and she migrated to the United States at age of 4. She went to college and medical school as part of a combined physician scientist program. That was at Rensselaer Polytechnic Institute and Albany Medical College in New York, where she received her MD and distinction in research and became the first doctor in her family, like a lot of people probably here. Her research during medical school and residency has ranged from basic science to cardiovascular prevention, cardiovascular disease in women, and critical care cardiology. One of her passions is medical education, and she's a big part of CardioNerds, and you guys should all look at that. What is CardioNerds, especially for those who are interested in cardiology? It's a digital education platform in various roles, including serving as a director of the CardioNerds internship. So she's doing great things. She's actually applying into cardiology fellowship. I am super bummed that she didn't even think about Mayo, but she's an East Coast person, and I'm sure she's gonna land wherever she wants, and she's gonna be a big, big deal. She's already a big deal. She's gonna be a bigger deal. But we want to thank you for coming on, and the reason we brought you on, Gurleen, is the people that you see here who were attending this or might watch this. A lot of these kids are IMGs who have devoted a lot of time towards Five River Heart Association, whether doing camps in Pakistan, India, working during the Ukraine-Russian war, whether working in the protest, working in medical camps all around the United States to help serve underserved communities. And I feel I owe them something for whatever time that they're putting in. That we should help them in their quest for not just residency, but to be better doctors, and to kind of maybe give them what you or me or we didn't have. So I look at you as someone who is doing great things. You're well involved, but the main reason I think we brought you in is if you can talk about research, because they all ask the same question. I don't know how to do research, and I don't know what to start. So take over.
No, thank you so much for having me. And I think all the work that all of you have done with Five Rivers Heart is just so admirable. And I think you're making such a big impact on so many people. So that's just really commendable. I think research, I like to think about it not just as research, but as scholarly activity. So I feel like when people get scared of research because it means that you have to have like your new idea and it has to be world changing. But I think research and in medicine overall, any sort of scholarly activity can help you think about medicine in a different way. So it can be a review article that summarizes studies or summarizes the recent research or whatever is known on the field. Research can also be just like case reports or case studies that offer a new glimpse or a new case that might not be something that people have seen before. And then obviously there's that traditional research where you have a new idea or you're looking at a new concept and trying to study why it happened or trying to figure out something that hasn't been shown before. So I think one important part is to think about it as a spectrum. And when you're thinking about pursuing research for residency or whether it's just your interest and you want to go bring back to that scientific community, think about it as any sort of scholarly activity. And I think the way to get started is you just have to read a lot. So you can't do research and you can't think of ideas if you don't know what's already out there and what people have already done before. So you need to like read the literature, read articles, and read a lot of them, right? So it's not just one or two. You have to familiarize yourself with everything that's out there and possible. And that can be a daunting experience, right? There's so much that comes out in research. So really focusing on and what is your interest? Like if for me it was always cardiology, so I knew that was a focus that I could point my attention towards because all of this takes time and you don't have time to read about everything in medicine. It's such a vast field and vast specialty. So first thing would be to figure out what is an interesting topic and your interests can change over time. You don't have to feel like the research that you do or the topics that you invest your time on have to be the same throughout the next couple of months or years. But first, just try to commit to one interest and become familiar with all the literature there is. And the more you read the literature, you'll get a sense of how people write, how people think. And the other important thing I think for research is it's very similar to medicine, right? So like in medical school, we see a patient and we think about like what is the question we're trying to answer. We collect the data from all the clues that we have from the patient and the data and the labs, and we formulate our kind of assessment. So research is the same thing. So you have to have a question, right? Formulating that question is really important. And that question can only come if you know what is the problem. So to know the problem, you have to read and know what's known and what's not known. And then once you have a question, you can figure out ways and connect with people to see how you can answer that question. So I think that's just kind of how I initially think about figuring out how to get involved in research. Happy to talk about anything in more detail, whatever.
Yeah, I think so. It's gonna be a very informal discussion. So,
Mm-hmm.
and people are allowed to basically, put their questions in chat, and if you want to raise your hand, you can do that as well. So there's, you mentioned a lot of things, and they're great things for any American medical student who's at, Cleveland Clinic, Harvard, Hopkins, UCS, like the big places. It's easy, right? You have the cases, the odd cases to write case reports about. Now think about that person who's in a developing nation, right? They might not have that, right? So these are the things these kids sometimes struggle with. First, don't have that world class facility or help. People who, and secondly, they might not see the odd cases, right? People that come to your place or my place are, referrals sent in from all over the world with odd things, and that gives us an opportunity to write about that, right? But
Mm-hmm.
sometimes these things are missed, especially if
Yeah.
you work at a place that doesn't have cardiac MRI or doesn't have even,
Mm-hmm.
basic imaging. So it's very hard to diagnose odd things. So, that's why it's it's easier said than done for these kids. But I think
Definitely.
the thing that you brought up, I really like it, because I think this is something. That's why I hope that some of the young kids in Punjab or in India watch this. Um, it starts early. It starts in college. It starts in early medical school, when you start reading journals. And as you do your studying, but you have to, once you start reading journals is when you actually get, like you were saying, you get the idea, what do people write about. And many times we the ideas that we think about, it's already been written. If you go and if you Google and you look at a lot of things that you might think about at first, they might be already written about. So then you keep reading and you keep reading and you come up with ideas, and those ideas is when you take it to a mentor and say, hey, I've read, instead of emailing a mentor and saying, I want to do research. You actually go ahead, the topic that you like or the topic that you are selecting the mentor in, and you read, and then you like, okay, these are the 5 ideas I think I need to work on, and then select maybe somebody, and then do that. So is there any resources kids can use, like early, I know you probably work with medical students that you guide on, is there any good resources that you remember that you can pass on to kids who are in college or early medical school, or trying to be interested in research? Like, one thing is coming up with ideas, writing case reports, sure, but is there, if they want to actually learn about research, is there a place they can go, and or just YouTube?
Yeah, so I think one thing is, as we were saying, that you need to read a lot, but how do you go about figuring out what to read? So I think an important thing is all of these journals, they have like a journal scan where you can put in whatever your topic you're interested in or whatever you might be wanting to do research in, and they'll send you like updates of the most recent journal articles that are on that topic. So I think that's one way to know kind of get informed about the literature that's coming out. The second thing is there's also organizations that work with medical students to like build some of those skills and also connect you with people. So you might not have someone at your own institution, but you can work with people even virtually. So I only know the cardiology aspect, but there's a American College of Cardiology medical student group that's been very active, and they've actually formed like a collaboration between medical students around the world, mostly international medical graduates from other countries that are working virtually with a mentor in the US to learn about systematic reviews and how those are done. And they've been working as co-authors and working on review articles and case reports and things like that. So that membership is actually free. Anyone can go and become a member of the American College of Cardiology and join the virtual medical student group where they can form these connections with other people and get exposed to other opportunities that might not be there at their own place or institution. Because as you were saying, Dr. Singh, that not everyone has access to those resources or those mentors at their institution. I think in terms of research skills, I think there's probably so much out there on Google and on YouTube. There's no like particular website or anything that I can like recall that tells you all about research. It's the more that you read and the more that you delve into it that you pick up the skills. I don't know if you have an example, but I don't think I've come across like one resource that tells you about how you do research or how you navigate that process. But it's more that you just have to kind of get your feet wet and get started, right? Rather than just being like, I don't know what to do, there's too much. So the more that you try to put yourself into that world, the more you'll get exposed to it.
Yeah, something I tell like kids that we work with is the easiest things to do is usually case reports,
Hmm.
quality improvement projects. You know,
Hmm.
quality improvement projects, especially in a third world or sorry, in a developing nation, it's all over the place, and that's something that you can really do and learn from. And some of the easy ways, like some ways, when if I remember, go back, you know, the easiest way to pick up things, like you know what happened, what do they do in Ghana, what do they do in Nigeria, what do they do in there, can I do the same thing in India, you know, for instance, I
Hmm.
mean, example, you know, this is what they looked at in China and this is what they found, how about in India, do you, so again, like Gurleen was saying, if you read what's out there, and if you have an interest that you pick, and then you go start searching what has happened in that world, and how can you can maybe combine two questions, or by combining two things get to the third question. So I think, you know, yeah, like you said, it starts with reading, starts with knowledge, and then interest, and then you can really pick up. And by the way, I think Gurleen is going to join our Anandpur clinic during January, and we're so excited. And I think that'd be a perfect time for getting, you know, for maybe, you know, going to a few colleges or something and giving a lecture or two. You know, I think the issue is hitting kids young. Like, you know, when people in India enter medical school, or, you know, many of them don't even know that they're going to end up applying to an American, you know, residency. You know, they're not planning for that. So you know, I see a lot of people from other countries who are taking their step exams in their second, third year of medical school in a foreign country. But we don't do that in India because, again, no one's guiding them. So I think you know, this is one of the reasons why we're trying to do this, is to guide kids, like, hey, you know, because and the reason we do it is, I don't know if you have come across this, but it's a very sad thing when a kid who devotes so much time towards his step exams, passes his step exams, and then doesn't get the residency. Imagine the money that they spent, and the family,
Yeah.
and the tears, and all this time, and that's heartbreaking. And it's not usually because they're not smart. I mean, these kids are kids who have gotten into medical school in a very competitive environment. So they had all the, you know, the IQ to do anything, but it's just that they never had guidance. So our goal is to make sure that at least we can give them what we might not have had, and, you know, guide them. So yeah, so good. Any other tips before we get into the residency, into anything you want to tell to, you know, your juniors and say, hey, do this?
I think the other important thing for research is you just have to be curious, right? Because oftentimes we're like, we don't know what's out there. But if you're asking question like, why does this happen? Like Dr. Singh was saying, like this was seen in a different country. Like how is it like in India? So asking those questions about why certain things are done and why things happen will give you questions and kind of help you formulate that thought process of research. The other thing I wanted to share with everyone is that the clinical problem solvers is also a really great virtual community to be a part of. And I've seen so many international medical graduates really use that platform to really connect with other people, get research opportunities and other things, including people from India, but I feel like more from other countries like South America, Central America. But it's open to everyone and it's a free virtual community that you can join. And they have a meeting every single day called Virtual Morning Report, where people can join in and they listen to a case that's being discussed, and you can volunteer to present a case or discuss a case. And that really gives you the platform to learn from other people, including people in the US that are doing their residency, as well as people from all over the world that are seeing cases. And it really exposes you to not just the ideas, but also the people and the network that can help you kind of form those connections and also get experience to mentors and other things that might not be available where you are at. So I think you should definitely check out their website, because I think I've worked with a lot of IMGs from other places, and they've really used that platform to help in their residency application, but also just to really have this sort of network to guide them at every step. And they also offer other things like personal statement workshops, interview practices, and other things through that.
Yeah, so I would recommend guys to, so a lot of them have been using that, by the way. Dr. Ravi
Mhm.
had introduced these things, and some of them have actually been presented, I believe,
Mhm.
cases. So I hope they keep doing that. And the other you said was ACC, the other.
Yeah, the American College of Cardiology medical student group, they also have free like webinars with journal clubs just geared towards medical students. And I think that's helpful because you have these experts list telling you about studies and how research is conducted and designed, and helps kind of show you a lot about how it's done. But they also have a virtual community where people, just medical students, are working on projects together. So if someone has a project, they reach out and say that we're looking for people to work on this virtually. And they used to do it on a website through ACC that's now dissolved, but I think there's a new ACC Doc Matter thing that also is able to connect members.
Yeah, so that's those are two good resources, guys, for you to use. Um, the other point, what totally slipped. Yeah, so research, it is hard again for IMG. I just like the stories I hear, and I know what they're going through, because you don't have mentors, right? You need a team to
Mm.
sometimes publish research studies, right? It doesn't take one person, and sometimes it's hard to
Yeah.
find it. But I think maybe connecting with these groups, just devoting a little bit of time a week, and then you get to know people, and you make, one thing I can suggest. I mean, you did your undergrad in with the research background, right? So maybe like when these kids wait for residency, since they've out of medical school, they're applying to medical school now. One thing they could do is do research masters, right? I'm sure in India you have masters that you can do in research in different colleges. Like, again, I'm not sure, but Punjab University, I'm sure, has something. Guru Nanak Dev University in Amritsar, or if you can afford it in America, you can do a master's in research, clinical research. There are colleges that offer all these type of courses. If you're like, oh, I need something kind of, you know, it will help you for life. Forget about getting into residency, but forget about, think about, again, I think a lot of people think about research as a tool to just get into residency, but what they don't realize is it's through this research that you're going to not just get into residency, you're going to get into fellowship. It's going to affect the job that you're going to have, unless you're like, hey, I just want private practice. But research can really open up a lot of doors, and some things that you might have never thought about. So don't think about it like waste of time, but think about it as a tool that's going to actually help you for the rest of your life.
Yeah,
There,
and it affects us in day to day, because if you're good at research, or if you just have that perspective and framework, it helps you bring the evidence-based treatments to your patients, so you know what's the newest things available. Because I think people who do research, it's not just, as Dr. Singh was saying, about the papers or about what you're accomplishing or what you're doing, but you're able to take better care of your patients, which is the ultimate goal, right, of medicine, is to bring what's the newest and latest to patients and be able to advance their care.
especially in specialties, like if you're going into hemonc, you're going into cardiology. I mean, all the time, everything that we do has to be evidence based. So every day we discuss, like, okay, if I want to do something, if I want to give it a certain medication, you're asking yourself, okay, is it, why are you doing that, right? There's a research study that backed that up, and you have to know why you're doing one thing, not the other thing. Why are you giving a blood pressure medication? Why are you giving a thiazide to this patient, and ACE inhibitor to that patient, and a calcium channel blocker to that patient? And that's something easy for you, for young ones. If you're early medical school, like, ask yourself, do you know the answer to that? Why are you giving this drug to a certain? If you don't know that answer, then you really already falling behind. So yes, like Gurleen said, reading research will really help you become a better doctor. But I think it's only when you start reading it you realize that it's not a waste of time. It actually will help you in your board studying. It'll help you in your USMLEs. Like it doesn't. It's not. It actually brings a lot of things together. It makes you, when you especially read a review article, it makes you think about that subject in a whole different way. So yeah, so tips to the kids, is read research. If you don't know where to go, like so places that I go, if I want to read journal articles, it's usually AHA. Type in AHA, ACC, something is printed in in those journals, and then if you're again, it's your interest, whatever you want to, that's for cardiology. Do you have a place where do you? Forgot my internal medicine days now.
Yeah, like the general Journal of Internal Medicine, like JGIM, also Journal of General Internal Medicine, and then obviously like the big ones like the New England Journal and other ones.
Yeah.
They have journal scans. So if you have like your specific interest that you can put in, you'll get emails every day of like things that come out. And that's a helpful way to just stay up to date about whatever topic you're interested in.
And start with intro. Like it could be daunting to read a 20-page research article. What I would suggest to you is always read the intro and the discussion and the conclusion. Start with that. Then slowly, once you kind of get the concepts, then you can go on to the methods and the other parts of the article. But reading that introduction, just read the introduction, and the conclusion will like bring so much value. I literally go through a ACC, like the journals, like whenever I have time, and if I'm on a plane or going somewhere, I'll grab like a couple of them, and I sometimes don't read the middle part. I'll read the introduction, I'll read the conclusion, I'll read the discussion. It actually brings a lot of thought, and like brings a lot of things together. There are a couple of questions on the side. Let me ask. The first one is research fellow in trauma department. Okay, so tips on this. Kids want to get into research. They obviously don't have anything, and then they're emailing people, right, to your place, Mayo, Cleveland Clinic, and they're like, please, I have no experience, please take me. Like, what is your way to approach this? Like, if I'm an IMG and I'm trying to get into research, what should be their approach?
So I think one is you have to have done your research about that person you're emailing, right? So know exactly what their research is and what is their topic that they're working on so that when you cold email someone, they probably get so many emails every day, right? Even my inbox is flooded with so many other non-related emails from things. So to really catch someone's interest, you want to really concisely have like why you're interested in their research. Because if you don't have any experience, you're not going to be able to write why they should take you, but how you can make a lasting impression. So maybe they do consider you is if you've read their research and say specifically, I'm interested in this because of this. And that can help filter out people who just send an email saying, I'm looking for a research opportunity. Can you please take me? I am looking forward to whatever. So I think instead of that plain cold email, you should say specifically, like, I'm interested in XYZ and your work in XYZ interests me. Because then people are just more likely to devote time and energy into people who they feel like will be motivated and will be persistent and will have basically have already done their homework in reading about that research. So really that's the way to distinguish yourself if you're trying to send emails. And the other things you have to send so many, right? So you have to send a lot of emails before someone will be able to give you that opportunity because either they won't see the email, if they see it, they might not have any opportunities, or they might not want to give an opportunity to someone they don't know and doesn't have experience.
I love that. That's such a great advice, and it's gonna be so hard to follow. But if anybody follows this, you'll be golden. So what she's saying is, let's say if like for we have somebody who's a half PEF guy here, heart failure preserved EF. He's big in that, And let's say you're emailing him towards that half PEF, or you're emailing, can I get research? And I've seen kids who just say, hey, I just want to do research. I have no experience, but I really, 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 I'm a hard worker. I have this score. But I think switching that up, forget it. Everybody knows, actually saying, my name is this. I want to do research with you because I've read your articles that show that this is this, and I have had previously worked in that, or I have great interest in working in that, And these were the 3 or 4 questions after, that I have about this topic, and then I want to work with you and learn more about. So I think, writing, if I'm reading that email, I already know that this person is not somebody I'm going to have to train in that disease. Like, so if I'm working in, let's say, HFpEF, I know that this person already knows HFpEF. Not that they're coming to me. Forget teaching somebody how to do research. First, you have to sit down and actually tell them about the topic. Make sure they actually know about the topic. So I think you're bringing that to the table, already becoming, coming prepared and doing something that other people are probably not doing. So I think that's great advice. So if you're emailing people, hey, I'm a great student, this and that, I think then, this is probably the better way to go, where you're talking about the research the person is doing, and write about what questions you have that you want to answer. And the way you can do it is read about that person's research. What have they published? And that will give you a lot of things. And then when they, if they, if they God willing, they message you back and set an appointment. Before that appointment, really read about that research and go over that topic, so you're well prepared. And the first thing they're going to ask you, why you want to do this, and then you can say, hey, I have great interest and I've read, and I have, throughout my medical school career, this was the topic of my interest. So that's a great, any other tips, small tips? That's a great tip.
I think the other tip, just if you do get the opportunity to work with someone, is you want to really put in really hard work and every persistent effort into doing the best job that you can, because one opportunity and one door that opens up more doors and opportunities. So I think I've heard this a lot from people, and I think it's really helpful, is you want to under promise but over deliver. So you want to deliver more than you said that you would, that whether that's deadlines or whether that's just the content and coming prepared to whether that's the meeting or the email. The more work you put in ahead of time, the more invested you'll be, and the more that people will be able to trust you in doing more work and more projects. So I think that's just like a principle, not just in research, but a principle, I think, in anything that you participate in.
Yeah, I think that those are, again, great tips. And something I ask kids, like, that we work with, like, hey, if you get into residency, make sure you do a good job so you can actually tell the program director, take that next kid, because that's the way things work, right? So if you get into a good research opportunity, don't just leave, don't just blow up, because then you'll close the door for everybody who's going to come behind you, especially from possibly from that region, possibly from that organization or whatever it is. So that's something that you should think about. And people talk, like, you know there's things in my resume that I'm applying for a job now, that people will go back to that person that I worked with back in residency, and they might be like, hey, how's this guy, by the way? So just remember, things don't leave, and bad karma doesn't leave. So work hard, like Gurleen said. So, like, let's say if you come to Mayo, right, and you don't really like the project that you're in, but keep working. But there's other things here. There are other people, and don't never feel like, all these big places, research places, they usually have a lot of resources. So if you don't know what you're doing, they usually have a lot of resources, especially for their own medical schools or students. And because you are there in that hospital, a lot of those resources then get opened up to you once you actually get that research. So yeah, work hard, and once you get it, don't feel overwhelmed. Everybody was There was a day in everybody's life when they didn't know what they were doing. And I mean, still to this day, I do things that I don't know, and then I learn, right? So don't get overwhelmed, but you gotta try and you gotta start. All right. The next one is pretty straightforward question. It actually, I can answer that, but basically, I think what Anmol's question is, um, because they don't have mentorship in India. So many times, you might have a case, but you like, how, you don't have a mentor, so you don't have anybody to publish to it. So I would say, Anmol, you have to have people. You have to have attending. You have to have a senior person who can sign off on that and say, yeah, this is what the case was. What's your input on that, Gurleen? I mean, she's saying that, how do you choose a journal where your case can go, and then, if you have a case report, and then can you publish it on your own?
Yeah, so I think, yeah, what you said, you have to have someone who knows where to send it to, because whatever that their track record is, it's easier to get it into that journal and know what types of journals are more likely to take that work. So really having someone that you're able to connect with who can was working on the case or was at the hospital is going to be helpful. And I think the other issue that becomes for publishing is whether there's a cost associated or not. So there's specific journals that are free to publish in. So really figuring out and looking up which journals are that don't have an associated cost.
Yeah, and I think a lot of kids in India sometimes think that research in India doesn't mean anything. And I think that's a false thing. I think you have to
Yeah.
realize research anywhere is research. And actually, people will really respect you if you have done that research in a foreign country because you're bringing something else on the table, knowledge and different skills. So I think, don't be so hesitant about sending stuff to Indian journals and getting accepted, or even doing research in India. You're going to have the same patient population here, underserved, the hospitals that you work at. So don't look at that. So again, yeah, that's good information. Somebody's asking, can you repeat the website? The first one was ACC, so ACC resource, and the second one was what is
Clinical problem solvers, the
clinical
virtual
problem.
morning report. I can put their link in the chat.
Thank you. It'd be nice if you can put that on. Okay, I think let's move on from the research part. A lot of people who are here. Okay, before we go to the residency, any tips for how to study while you're away from steps now? So I shouldn't talk about steps. Forget about medical school. I don't think I need to ask you that. That's something that I want you to, though, when you go to India, to think about how to guide
Mhm.
kids on steps, studying and getting into medical school and things of that sort. But for now, okay, they have applied into residency and they're sitting back. What do you think they should do? Is there any tips that you can give?
Yeah, so I think if you've submitted your application and this is the time period when interviews are starting to come out, I think one important thing is to keep an eye out on when programs are sending out interviews. And if you don't hear back from them and there's programs that you're interested in, or there's programs that you haven't heard back from, then really showing your interest in them. So you can send them an email. And this is the same thing when we talked about for research. They're going to get so many cold emails and that's not going to mean anything. So you want to say again, specifically, I'm interested in your program because of XYZ, and my interest in XYZ match with that, or whatever specific thing that you can do to show that you actually want to come there and you bring a common interest or something in their program that you are going to really match well with. So I think that's one thing. The other thing is when you do get an interview, like even if it's one or two, it's really important to really do your homework about that program. So when you're showing up for that interview, you want to know everything that's on their website. You don't want to ask anything that is publicly available because they want to know that you've worked hard to know about their program and you're committed to and interested to come there. The other thing is, this is more for just interviews in general, is you want to have like at least like 5 or 10 questions ready to ask them, because a lot of times interviews are might end by saying like, what questions do you have for me? And you want to continue that conversation and you don't want the interview to end in like 5 minutes, right? You want to take up that whole time to show your interest. And the way to think about what questions to ask them is things that are not on the website. So you can ask them about their experience, like how has the program changed over time? What are the strengths and weaknesses from their perspective? What do they do? Like, again, read about their research, read about their work, and that will help you make sure that you form a connection with the person interviewing you. And then the other thing I think is if you're not getting interviews and maybe the match season is not going along like you had anticipated or expected, then to continue doing everything else to strengthen your application, right? So whether that's research or whether that's some sort of quality improvement or it's medical education, like whatever you've been working on, continue that. Don't stop a project like we mentioned before, just because that you've submitted your application. It's not a stop period, it's a continuous process. And anything you do during this period is only going to help you, whether it's for this match cycle or next match cycle, or also just for your future career in medicine.
I mean, I think those were golden points. I think that again, this was something new that we haven't brought up in our organization, is this point about, read about. I think this is something I did but I totally forgot that. Read about the PD, the person that you're emailing. Read about his research. What has he done? Or the person you're emailing, or there's something in that hospital that is, they work in an underserved area, or the guy does a humanitarian, he does humanitarian work. And you can write in an email, hey, you do this, and that's why it interests me. And people love to hear about themselves. So if you in that email write a couple of things about that person, like, hey, you did, you published this article, and I read it, and it was just such a great article. And the oddest thing was, there was this one great article, there was one Jack article I read, uh, and at the time I didn't look at who wrote that article, but when I came to mail, I I I I reviewed the article again, because it was on constriction and restriction. And then I realized it was the program director at Mayo who was and then went to him. I'm like, man, this is, so it's like the people that the research out there that you're reading is the real people here in the real world, right? So read about that person. What have they done? And bring that maybe small thing in your email. Hey, I really love the work that you do, and I really, really would love to work under you. I think that's a better way to write the email. Write about a couple of things about yourself, than saying, hey, I really want a spot at your hospital, because that's everybody's writing that. So you want to be different, you want to show effort, that hey, you went the extra mile to collect more information, and that's what they're looking for. Did you just write a generic email? Because you're going to get a generic reply. You write a real personal email, there's a chance you will get a real personal message back. So I think that's a great tip, especially if you're not getting too many interviews. You have to be thinking more personal than generic.
Mhm.
Next one is it's a pretty straightforward one, and it's about case report and case series. So they're asking, so case report is simple. You see a disease, you write about it. Case series, you saw multiple. So for instance, now I'm writing something about LVADs and TAVR, and in our hospital we have done like 9 or 10 TAVRs in LVAD patients. So if you have that experience, write about it. So that's the question. How would you like to answer that? Case series and case report.
So I think the framework is similar, right? You're describing things that you've seen, but now you're doing similarities and differences between the case rather than just saying why this one example was similar. So it still counts as scholarly activity and research in the same sense, but it's again thinking about how you're going to frame that discussion. And the more that you read, the more you'll learn, right? It always comes back to the same thing. So if you're publishing a case series or trying to do a case series instead of a case report, read how other case series do it. How do they compare different things, and how do they formulate that discussion? I think that discussion section is the most important part of the paper, because you learn not just about the work they do, but how they put it into context in terms of the literature that's already out there. So I think just giving yourself an example, and whenever you're writing anything, having like 2 or 3 papers that you want that are really, really good, and just seeing what type of language they use, just in general, right? Just how do they frame that context? How do they think about the way they organize their discussion? That helps you get that sense of, when you're writing, how you want to formulate it. So I think that's also really helpful.
I think, again, that's a great tip. So if you want to write a paper, right? If you want to write a case report, read 100 case reports, and you actually wouldn't even need to do anything. Things will come in try this. You want to write a case report, you want to write a case series, read, this is, anytime I'm trying to write something, the first thing I do is go online and figure, read a lot. And then I usually have my Word document open on the right side, and I just kind of drag things and drag ideas on the right. And after you read, literally 10 or 5 to 10 papers on something, you're already ready to go. So if you want to write case series, you want to write a case report, you want to write a quality improvement project, or you want to develop something, you have to read about it. If you want to read it, if you're writing about pancreatitis, read about cholecystitis. Literally same thing. What did they do in the cholecystitis? You're going to carry on and do that in pancreatitis. So everything is out there. You're not inventing something. Research, I know it sounds hard, but everything is out there. Just take it from a different plug and plug it into whatever you're trying to do. I think, yeah. So I think those are great points, Gurleen. The next one, there's a lot of stats softwares, right? That you are like required, or not required, but like, if you're doing meta-analysis and things of that sort. So I think this is a tough question. Think about somebody in India. who has no idea about research, and all of a sudden they email people like, I want a research spot, and they get a reply, do you know this software or that software? So it's like, what, all I know is how to write a case report or a case series or quality improvement. Now what about this? So do you have any tips on that? Do you have any experience on any of the softwares, and what can kids start with if they were supposed to?
So I think there are YouTube videos on like common softwares. Like the common softwares are like SPSS or Stata are the statistical softwares that are most commonly used. So I think the question was like if you're applying for a research position, I think you want to be honest, right? You don't want to say you're the expert or you know everything about statistical software, but you can say that you're willing to put in that time and effort to learn, right? People are looking for people that are easy to teach and learn. You don't have to be an expert when you're starting research, right? Like there's so much in statistics that I don't understand and I don't know how to do, but sometimes those hospitals and positions have people there that can help you with the analyses. They have statisticians, they have data analysts, or the mentor that you're going to be working with has access to resources that you can take advantage of to build your skills so that the next time you can say that I do know how to do something. So I wouldn't put that as a barrier to not sending emails if you don't have any knowledge. But in the meantime, when you're sending emails, at the same time, you can watch YouTube videos and learn a little bit about the basics. You don't have to necessarily know how to do every single analysis, but just understanding how one software works or what is the basic, like what is a p-value, what is a hazard ratio, like those terminology will help you be able to understand research, read research, but also just have that knowledge set. So when you're talking with someone or a mentor, have an opportunity, it makes more sense to you what they're telling you about their research. So just familiarizing yourself with that basic terminology and statistics is helpful. You don't have to know exactly how to do the analyses.
Yeah, I think that's a great point. You know, we get overwhelmed as medical students, as IMGs. You get overwhelmed. You're like, I don't know this, I don't know that. I mean, you can't learn everything. Like, you can't be a good doctor, good researcher, good human being in one day. Think about that. And no one expects that out of you. Stop expecting that out of yourself, right? So apply for a position. Like she said, go to YouTube, learn about that software. But once you get there, like say if you come to Mayo Clinic, right? There are resources here that your PI will like, guide you. Hey, go there. Or there's a session going on, or watch these videos that are only available. So we have like our own portal where a lot of things are not available if you're not part of the Mayo, like, the Mayo world. So once you come to Cleveland Clinic, you come to Harvard, you come to Hopkins, you come to these places, they actually have a lot of these things built in their research departments. They have, courses and things that you can take to become better. So don't not apply because you don't know something. Just say, hey, I know stuff, I know it, I've read about, I know it, and I'm ready to learn more. And once you're there, just spend time and learn more. Yeah, that's a great point. So do you have any other final things? I'm not going to hold you back, but I'm looking forward to you going to Punjab and you spending time with kids there. And I think I will really, really hope we get a lot of medical students to listen in, and I hope you can just mentor and just like pass on some knowledge, and that'd be great.
Yeah, no, I'm really looking forward to it in January.
Thank you, everyone who came. Thank you. Let me see if this one. Thanks, doctors, your response. How much time should we wait before reaching out to programs? It's already end of the second week after application. Okay. Do you have a time? When should they reach out?
I think it's helpful to know when programs have sent out interviews because if other people have gotten interview invites, then it's a good time to send the email because maybe they sent out their first wave. There's usually like a spreadsheet somewhere floating around in the internet. I remember this was the case 3 years ago when I applied to internal medicine, where people just randomly on the website, it's like a Google spreadsheet or something, anonymously, right? Like they got an interview from this place or this place, and that just tells you kind of where programs are at in terms of sending the application. So if other people have gotten an interview, then you should email the program director and say that you're interested because that means they've sent out their first wave.
Gurleen, the world isn't that nice. There's yeah, somebody wants to send a spreadsheet, but I remember from my application time, it's not so clean. Like people, so
Yeah,
so
the
don't.
spreadsheet has some crazy things.
Yeah, so guys, don't. You are in a there's competition, and some people take this as competition. So be careful what advice you listen to. Be careful when somebody tells you something. Always, don't lose yourself. Like, think, before, hey, if somebody say, hey, you don't have to go there a day before, just go there the morning of. Like, think about that. Like, it's your life, right? So again, these things, just be very careful. It is a competitive time, and sometimes you might not get the right information, so be very careful. So Gurleen, thank you so much, and thank you everybody who came. I think we have some more sessions with other people and see what, again, the big thing is a lot of these kids are doing a lot of good things, and I think something that I didn't have, and you probably didn't, I don't know, it looks like you had mentorship. And I think there's a big need in our community, or there's a big need in overall every community, every underserved community, to have mentors. And thank you so much for devoting your time towards this, and look forward again to you going to Punjab and working with our team there. Thank you.
Thank you so much.
Thanks everyone. Take care. Bye.